Osteoporosis is a disease that affects millions of people worldwide. This condition makes bone tissue more fragile and therefore more susceptible to fractures. But what's the cause of it? Factors such as lack of exercise, a diet low in calcium and vitamin D, smoking, use of certain medications, or aging may contribute to its onset. Symptoms may be mild or even absent, but fractures are a common sign of this chronic disease. Although there is no cure, osteoporosis can be treated and managed with a combination of lifestyle changes, medications, or therapies. That is why it is so important to be diagnosed promptly. I am Dr. Mariagiovanna Filippella, a specialist in endocrinology and exchange diseases. In this video, we will try to understand together how osteoporosis diagnosis occurs, and how important it is to reduce the risk of complications. As mentioned, osteoporosis is a disease that involves a reduction in bone mineral quantity, which is why bones become brittle and more susceptible to fractures. To measure bone mineral quantity, it is necessary to use CBM, the Computerized Bone Mineralometry, the test indicated by the World Health Organization for the diagnosis of osteoporosis. How does this diagnostic test work? The MRI, referred to as DXA, allows the amount of bone mineral to be measured using a double X-ray beam. The radiation transmitted is very low, and the most commonly used sites for this examination are the vertebrae and femur. However, to interpret the results, osteoporosis occurs when the number that corresponds to a quantity, called the T-score, deviates from what is the person's ideal value. This T-score is compared with his or her peak bone mass, which corresponds to the maximum amount of bone mass the person can have around age 20/25. The results are then interpreted in this way. If the T-score is between 0 and -1, the bone mass is considered normal. If the value is between -1 and -2.5, it is called osteopenia. In case the T-score starts from -2.5 and up, then it is called osteoporosis. How is the diagnosis of osteoporosis made in patients with osteoarthritis? It is important to note that in arthritic individuals, the femoral site may be the most reliable, as arthrosis tends to mask the osteoporotic vertebra. In these cases, the bone mass may look better than it actually is. For this reason, it may be useful to perform MOC DEXA equipped with a vertebral bone trabecular texture reading system, which is called trabecular bone score, TBS, which can also provide insight into bone quality. This score is related to the number and density of bone trabeculae, but how is it defined? To best understand, let us take female subjects in postmenopause as an example. In this case, the following values can be considered valid. A score greater than or equal to 1350 is considered normal. A value between 1349 and 1201 is considered partially degraded microarchitecture. A score less than or equal to 1200 is considered degraded microarchitecture. However, it is recommended that both femur and vertebrae be evaluated, as generally bone mass at the femoral level is lost later than at the vertebral level. With the DEXA MOC Morphometry example, the height of the dorsal and lumbar vertebrae can also be measured, allowing us to detect any somatic subsidence. There are other useful methods for assessing bone quality: trabecular density toward the bone cortical or bone trabeculation. Let us see together in detail what they are and why they may be requested. A quantitative computed tomography scan may be prescribed either for the vertebrae or the femur. This type of diagnostic examination, however, gives a lot of radiation to the patient, which is why it is little recommended. Another method of evaluation consists of peripheral quantitative CT, pQTC, which measures bone mineral quantity, for example of the tibia. This type of examination can be helpful for those osteopenic patients who fracture due to worse bone quality, which is not visible with DEXA MOC. A high-resolution micro-computed tomography scan may also be requested at the level of the tibia or forearm. In this examination, radiation is minimal, and it is possible to have information not only on trabecular and cortical mineral density, but also on the connectivity of trabeculae, their thickness, and cortical porosity. A further diagnostic test, which can be overlapped on DEXA as a result, is REMS, the radiofrequency ultrasound multispectrometry, which consists of an ultrasound scan of the vertebra. This type of examination is not recognized for the free prescription of any therapy, but it can be of help in the follow-up. Finally, it may be useful to take an X-ray of the dorsolumbar spine if vertebral somatic failures are suspected. In conclusion, we recall the importance of diagnosis in the case of osteoporosis, as this disease makes bones fragile and susceptible to fractures. If left undiagnosed and treated, this condition can lead to significant complications, such as chronic pain, loss of mobility and range, and increased risk of fractures. Early diagnosis allows you to identify the risk of developing osteoporosis, and to take preventive or therapeutic measures to improve the quality of life of those affected. We have come to the end of the video. I bid you farewell and look forward to the next one.